Good morning, Richard Buckley here, Milford MD. Thanks for watching yet again. Another episode of whatever we're up to. Most of the days I would say probably we don't film, otherwise it might get a little repetitive. In some ways you could say today's repetitive. We have shown Vaser before, which is what I'm doing right now. We've shown tummies before, we've shown Lipo before, but you know what? Every patient is different. And before we do anything, we figure out what the patient would like to accomplish. And that always has some nuances. Sometimes people want clothing to fit better, or maybe they just want to look better in clothing, or maybe they want to look better out of clothing, or maybe they have an event that they're preparing for. So we always discuss all of those things. And then have a look at the area we're going to work on. This is an abdomen here. Our patient has had a tummy tuck elsewhere in the past. Looks like a nice scar. I think they did a nice job. But there's some extra fullness, you can say fat if you want, that our patient would like to get rid of. And so we're going to do that today. I'm in the process right now of bouncing the fat cells off of where they're adherent with a gadget called Vaser. You know, there's Kung Fu, this is Hai Fu. Kung Fu, Hai Fu. Hai Fu is highly focused ultrasound. So this thing has rings on the end of it, this little probe. This one has 3. I can have 1, 2, 3, 4, or 5. 1's the most aggressive, 5's the least aggressive, 3 is in the middle. I like 3, I use 3 a lot, sometimes 2, but mostly 3. And yeah, it just makes things, see, if you look at my hand here, I'm not even holding this handle, and it's just sliding as smooth as can be, right? Now right there, if I can find it again. Now it's all smooth, but sometimes there'll be a point that'll stick, like right up against our patient's scar there. You can see it sticks a little bit sometimes. And I work this so that everything is smooth. So one of the so-called endpoints of this treatment is loss of resistance. In other words, my tool will move smoothly through the subcutaneous tissues. I'm on top of the patient's muscles, or abdominal muscles, and underneath the skin in what's between the two, which is fat, known as, since it's beneath the cutaneous, the skin, it's called subcutaneous fat. These little white things are called ports. Just make a little tiny slit in the skin after it's numb, of course, and put that in, and what that does is it prevents this little tube from touching the skin, so that if I would, for example, come out of that little entry point with the end piece, then it's not going to do any damage. If I didn't have the little protective port in there, the ultrasound right at the entry point wouldn't be good for the skin. So anyway, those come out as soon as I'm done with this. By the way, you awake?
Yes.
You've been listening to me?
I have.
Anything sound good?
It sounds interesting.
Sounds interesting. So you see our patient's awake, and what are you feeling?
I don't feel much of anything. It just feels like things are popping.
Popping, all right.
I don't want to say popping, like bubbles are popping.
Bubbles.
And
So,
I don't really feel much.
okay, so you're comfortable.
Yes.
All right, excellent. And you can see here, sometimes I run into a firm area, like that's firm right there. I'm talking to the world now, not you. So, in that area we will blast through with our ultrasound. You see, I just blasted through that. And I do it until it's totally smooth everywhere. Also, there's some guidelines how much energy I might put in. So we used 2,500 cc's of numbing fluid today. 2,000 is half a gallon. So we have a gallon plus half of another quart in the waist and the full abdomen in order to tumescent, which is two things. The tumescent numbs the areas we're working on, a good thing. It also puffs it up, which is what tumescent means, to expand or puff up. So that we're kind of working on these areas much as if you had an image on a computer and you enlarged it in order to work on the little pixels. And then when you were done, you shrink it back down to its original size or whatever size you want. So we have these areas that we're working on enlarged to best. And I'm putting in something between 60 and 90 seconds worth of 70% Vaser energy per 100 cc's of fluid that I put in there. So for example, if I put in 2 liters of fluid, 2,000 cc's of fluid, and I wanted 60 seconds per 100 cc's, then there would be 20 of those. So I could laser, Vaser for 20 minutes. Or I can go up to 90 seconds per that 100 cc's, in which case I could do this for 30 minutes. Also today, after I've done our liposuctioning, we're going to use Renuvion, also known as J-plasma, which is a plasma energy. And that plasma energy is going to get us some additional tightening. So Vasering, liposuctioning, Renuvion-ing, or J-plasma-ing, in order to sculpt our patient's abdomen, her waists, and get tightening. Renuvion is very helpful, that plasma energy, to stimulate a tightening process. It is nice after the procedure to do some lymphatic drainage, so we kind of go over the areas we worked on with some radiofrequency energy, kind of help move the fluids that may be left in there into the lymphatic channels. We also have our patients wear some little Spanxy compression garments. It's better to wear them longer than shorter. At least a month. I think it's nicer probably to wear them even longer. Well, I think that's about all we have to say about this. So you feel like you could just jump up and do whatever?
I actually do.
You actually do, yeah, except you need to hang here with me for a little while longer until we finish this up. Anyways, your patient's awake, she's totally comfortable, we're having fun. The music was turned it down so you could hear me. For fun, we run a HEPA filter in the OR, which just keeps the air in the room, exceedingly filtered and clean all of the time. And our patient is lying on top of odds and ends of things, and underneath all of that is what's called a bear hugger. So it's a little device that will flow warm air around. Are you totally warm?
Yes.
Yeah, and I don't like people cold ever, and I don't want to roast them either. Sometimes we have to turn it down, but it's nice. Yeah. And then I dress like this because it's actually not simply a clean procedure, it's absolutely a sterile procedure. So, I hope that was a bit informative. And even though some components are similar to other videos, probably I said something a little different or in a little different way, and I hope it was meaningful, educational. And by the way, if you were thinking, geez, what would be good for you, then just give the office a call, come see us. We'll let you know exactly how we can help. Thanks for watching. Milford, MD.